Unchanging underlying principles and unique features of Ayurveda. The unchanging principles of Ayurveda are one feature that sets this science apart from other healing sciences. The principles and pillars of Ayurveda discussed here are the three dosha and the five element theory, the importance of individualized, holistic, and detailed approach to healing, and the benefits of Panchakarma healing treatments. A holistic approach. The holistic approach of Ayurveda is well known. A detailed history of each patient is taken, and every aspect of his or her life is included in the analysis. Aspects that are considered include what the patient has inherited from his or her parents, where he or she was brought up, the routine diet in that region, common diseases in that region, when he or she wakes up and goes to sleep, constitution, how, when, and what is eaten, past illnesses, and so on. This gives a complete picture of the patient and provides guidelines for treatment. Ayurveda considers every aspect of life and nothing is left out. I would like to mention a few examples. A case was referred to me of allergic urticaria, a kind of skin rash. He had been suffering from this disease for the last 5 years. He had to take anti-allergy medicines every day. When I took the history, I found that originally he suffered from hyperacidity and was treated with antacids for 5 years. The symptoms like heartburn and headache stopped after that, and so the treatment of hyperacidity was discontinued. After 5 6 months, he started suffering from urticaria and was now being treated for that seemingly unrelated disease. What I found after a detailed consultation was that the hyperacidity and urticaria were only symptomatically treated. No one had bothered to examine the lifestyle and correct it. As a result, the root cause was ignored and one disease turned into second versions of the same problem. Yogurt, pickles, spicy non-vegetarian food were the causes for that were the causes for the disturbance of pitta, leading to both the diseases. I advised him to change his lifestyle and food habits. He was cured from both the diseases once and for all through diet changes and proper treatment. Another case reported to me for the loss of weight and intermittent loose stools. This patient did not respond very well to my treatment at first. I kept on asking for any psychological ailment, and finally he told that he had a fear that he was suffering from cancer. I tried to convince him that it was not the case and that he should stop worrying unnecessarily. but he was unable to stop. He was subjected to multiple tests, including liver and bone marrow biopsies, and finally, it was confirmed that he could not possibly have cancer. The patient then improved miraculously. Tridosh. The theory of Tridosh is one of the pillars of Ayurvedic theory and practice. Vata, Pitta, and Kapha are the three doshas and the basic constituents of the body. They are called dosh because they have a natural property to get vitiated by causative factors, and they also have a tendency to vitiate other dhatu, body tissues, and mala, impurities in the body. In a balanced state, and doshas, the doshas in a balanced state, the dosh work together to maintain perfect health. But when imbalanced, they lead to all diseases. Vata, Pitta, and Kapha are symbols of three universal forces which, in harmony, run the universe. Disturbances may occur due to food habits, behavior, improper daily or seasonal routines, trauma or injury, psychological factors such as stress, etc. Along with those, the basic five elements which constitute them must be considered. Vata is responsible for all movements in the body. Vata's main characteristic is that of a motivating force. We see motion in the universe, even within atoms in the form of electrons moving around the center and also of the planet Earth around the Sun. The galaxy contains so many suns and planets, and the galaxies also keep on moving away from each other. What is the force behind all such motions? According to the Vedic wisdom, it is the universal Vata element. Its symbolic representation in a living body is the Vata dosh. It is responsible for various activities in the form of blood circulation, muscle actions, respiration, etc. in a living body. We can imagine the importance of Vata dosh since it is necessary for any action. Pitta is a representative of heat energy of the universe in the form of the sun. This energy is responsible for digestion and transformation. The sun in our planet, in our part of the universe, does the job of conversion of seawater into potable water in the form of clouds through evaporation. That's a great job. In the same manner that Tejas or Agni element through Pitta dosh is responsible for conversion of food material into body tissues. This is also a great job and is the root of health as well. If the conversion is proper, a perfect health is maintained. Kapha is a symbol of cold energy of the universe in the form of the moon. This may sound little strange as today's sciences do not call cold as energy. They only consider heat as energy, starting from absolute zero. But according to Vedic wisdom, the sun and moon represent two opposite energies, influencing our health in the form of hot and cold seasons, summer and winter. It is very well known that cold season is healthier as it gives strength to the living body. Kaphadosh, the symbol of moon energy in the living body, plays the same role of giving strength to the living body, especially in the winter. It is also important for avoiding friction in the body tissues during various movements and also for the nourishment of the sense organs. The doshas have a direct relationship with the basic five elements Mahabhut, Vata, air, Vayu, and space, Akash, Pitta, fire, Tejas, Kapha, earth, Prithvi, and water, Jal. An increase in one or more elements can cause an excess or decrease of a particular dosh. It is this imbalance that is an essential ingredient for diseases. A quick example is eating a very fiery hot meal and then having heartburn soon after. The heartburn is an immediate sign that Pitta dosh has become unbalanced due to the fire element that was so prominent in the meal. Most diseases take weeks or years to manifest and involve more than just a doshic imbalance like this example, but are the product of long-term doshic imbalance that has compromised the health of the tissues. Chronic heartburn or acidity is the more advanced stage of this imbalance caused by too much fire and pitta. With the help of proper diet, daily routine, psychological factors, herbs, and panchakarma, balance can be restored. Individuality of path to healing. Ayurveda is a science of healing individuals. The formation of disease is a complex phenomenon with many factors involved. The qualities of any particular disease change according to the quality and quantity of the causative factors. Let us take an example of bronchitis. According to Ayurveda, bronchitis is mainly related to kapha and vata dosha. In any 10 patients, the causes of bronchitis may vary from patient to patient. The cause for the increased cough may be eating sweets in one patient, ice cold water and ice cream in another, fruits like banana in some others. Other common causes of bronchitis are smoking and irregularities in eating habits, both of which lead to disturbance of vata. The quantities of the cause may also vary. One person may consume 2-3 chocolates a day for years. Another may consume 1 to 2 per day for few months. The signs, symptoms, and longevity of the disease also vary from person to person. The basic constitution of individuals and the conditions of their lives are also different. The obvious outcome of all these variables is that the disease will manifest differently in each patient and the cure must be different for each patient. So, what is Panchakarma anyway? Panchakarma is another unique aspect of Ayurveda. It is a set of treatments and procedures that expel excessive dosh from the body. This is the best choice of treatment when the dosh has accumulated for a long period and in great quantity. For example, if one is fond of eating ice cream and keeps on eating it daily, even in the winter, it gives rise to increase of kapha dosh in the body. This tends to lead to reoccurring sinusitis, bronchitis, asthma, etc. To get cured, one first has to stop eating ice cream as that is the cause of the disease. If one were eating ice cream for a long time, very frequently and in large quantities, Naturally, the accumulation of dosh would be great and hard to get rid of. If one stops consumption, gradually the effects will go away and the person will be freed from the disease. But this will take quite a long time. If we start consuming something which will nullify the effects of ice cream, like ginger, then the recovery will be faster. But if we expel the accumulated kapha dosh in one stroke, the recovery will be even faster, sometimes immediate. According to the text, it is even wise to do panchakarma annually for maintenance of health and for better progeny or in infertility. This is because of the fact that cyclically the dosha keep on accumulating in the body in a particular season. If they are expelled out in their aggravated state, no further question of creation of a disease arises. Hence, to maintain health, every individual should undergo panchakarma every year. Cleaning processes are required before conception to have good quality of progeny and to reduce the effects of hereditary diseases like diabetes, etc. It's like painting the house. We have to remove old color fully and then apply new color. So we prepare our body by cleaning processes to welcome a new baby. The following Panchakarma procedures are quite detailed and must be performed under the supervision of a classically trained and experienced Ayurveda practitioner. Panchakarma is now becoming very popular due to its instant effectiveness. However, it should be undertaken with serious intention of healing and not just a spa treatment. Vaman, this is a scientific process of inducing vomiting to get rid of the excess doshas. It is especially useful for kapha and pitta dosh in diseases like sinusitis, bronchitis, asthma, skin disorders, hyperacidity, herpes, etc., and in general for prevention of diseases caused by kapha and pitta. It is an elaborate procedure to be performed under supervision of an Ayurvedic expert. Kapha dosh is sticky by nature, so to separate it from the body and to protect the tissues, the application of oils, snehan, is administered first. The patient is given medicated ghee oil internally and the external oil massage daily. The dose is increased every day to reach such a quantity that the person will not feel hungry for 12 hours. For example, if he or she consumes ghee at 7 a.m., he or she should require 12 hours to digest it and feel hungry at 7 p.m. This dosage is then continued until the necessary symptoms of optimum oleation, signs which show that the body is fully saturated with ghee, are seen. Steam svedana is also given along with snehan. This preparation takes 5 to 7 days. Then after a 1 day gap, vomiting is induced by medication. The actual process may require 2 to 3 hours for completion. The rest is advised on the day of the process and a special dietary regimen is administered before returning to a normal diet for 3 to 5 days. The whole procedure with preparation and aftercare may require 10 to 12 days, depending on the individual. Virechan. This is a purification process producing loose bowels to remove the excess doshas. It is especially useful for pitta dosha and diseases like hyperacidity, skin disorders, herpes, etc., and also to prevent diseases caused by pitta dosha. In this procedure, Snehan and Svedan are performed daily, as with Vamana. Medication for producing loose bowels is given after a gap of 2 days. Dietary regimen and the rest are also observed, like the Vamana procedure. Basti. This is a procedure useful for Vata dosh and diseases caused by Vata like backache, arthritis, multiple sclerosis, scler- sclerosis, etc. It also helps in preventing diseases caused by Vata dosh and can be used as a rejuvenating treatment. The route of medication during the procedure is rectum, but the procedure is different from Western enema. The only similarity is the route of administration. Two kinds of basti are given: oil enema, sneha basti, and enema of various preparations consisting of herbal decoctions, oil, honey, salt, and herbal powders, etc. Niruha Basti. A series of 8, 15, or 30 basti can be arranged depending on the severity of the health problem and the strength of the patient. Basti is one of the most important treatments in Ayurveda. Rakta Mokshan. According to Ayurveda, many diseases are caused by impure rakta, a body tissue which can be compared to blood. As a consequence, removing unhealthy blood from the body serves as an effective and immediate treatment, as the impurities are removed directly through this process. This is done in several ways. The application of leeches is best for local conditions and provides instant relief in diseases like migraine, piles, abscess, arthritis, toothache, and even in acute appendicitis and herbs zoster. A more systematic treatment involves internal and external swedan, and then letting the blood out through a needle. This is effective especially in skin disorders. Nasya. Here the route of administration of medication is through the nose. Drops of medicated oil, fresh herbal juices, milk, etc. are inserted into the nostril. This is very useful in diseases of the head, ear, nose, and throat, such as migraine, sinusitis, etc. Medicated drops can also be used for complaints regarding the hair, such as thinning or graying of hair, and even for strengthening the senses. To summarize, getting a disease or becoming ill is a complex phenomenon involving many factors, and achieving health again as is also dependent on many factors. Every medical system has its own views about this, and treatment and drugs are part and parcel of the systems. 2. The meaning of Ayurveda is something by which we try to know or understand about life. Ayush. It would mean something by which we gain Ayush. Ayurveda is something which has a presence of Ayush in it. 3. The existence of Ayurveda over thousands of years shows that it is time tested and has got a very firm base. 4. Unchanging basic principles, individuality, holistic approach, panchakarma are the unique qualities of Ayurveda which distinguish it from other medical systems. Ayurveda's special approach to illness. Every medical system has its own theory about health, illness, and solutions to illness. Diagnosis, medicine, and treatment are all determined by the theory or paradigm of each medical science. Being a complete medical system, Ayurveda has its own internal logic with unique diagnostic methods and treatment principles. Each illness, Vyadhi, described in Ayurveda has a unique disease process, Samprapti, that is usually different from modern medicine. Illness, Vyadhi, are described in detail in the text along with their symptoms, variable states, and treatments. Many ailments that are seen today fit neatly within the parameters of these illnesses, Vyadhis. Ayurveda can handle health problems that fall outside of the described illness, Vyadhis as well. In these situations, there are basic principles of disease formation which help the practitioner analyze the condition and treat it successfully. Diseases which reflect the symptoms of cancer or AIDS, etc., are not found in the text, but these diseases are managed successfully through treating the dosh and dhatu imbalance in accordance with the general principles of Ayurveda. Ayurvedic treatments, including all medicines, diet, and lifestyle, panchakarma, are logically developed from underlying principles to fit specific situations. The first step in addressing any illness is always to determine the cause by looking at the details of the ill person's diet and lifestyle history from childhood. The causative factors must be stopped in order to slow down the disease process. Once this is achieved, half of the battle is won. Since the causes which are feeding the disease have stopped, the disease naturally starts diminishing by the principle of natural dissolution. Swabhavo Parama Siddhanta. And now incorporating positive diet and lifestyle changes will start the process of building good quality body tissues. This ensures that the disease can be reversed and there will be less chances of recurrence. Before the starting Before starting herbs and treatments, we have accomplished most of the healing process. If you have enough time, diet and lifestyle alone can heal many problems. It is said that whatever duration of causes are seen in a particular imbalance, the same amount of time is required for the body to naturally heal by correcting diet and lifestyle alone. But many illnesses, Vyadhis, have taken so long to develop that herbs and treatments are necessary so that the patient can outlive the disease much earlier. Herbs and treatments are given based on a thorough analysis of the health condition. These treatments are of two types, actually curing of the disease and removing the weakness which allowed the disease process to begin in the first place. Many people know the term rejuvenatives, rasayana, which achieve the second part. Chawanprash is a famous example of a rejuvenating rasayana that is commonly used to maintain strength and avoid further health problems. Becoming ill is a complex phenomenon involving many factors, so regaining health is also dependent on many factors. It all depends on the tools available to the healing system. There are definitely instances where a condition is considered untreatable by one medical system but treatable by another. Because Ayurveda has an understanding of causative factors and rejuvenatives, rasayanas, diseases like cancer, even in advanced stages, can be treated or at least made far less destructive. My book of Cancer, Heart Disease and Diabetes, Prevention and Treatment in Ayurvedic Perspective deals in detail with these three very common serious illnesses. To summarize, 1. Individuality, holistic approach, Panchakarma are the peculiarities of Ayurveda which has helped it sustain through time as a medical system.